This is the plain X-ray of paranasal air sinus, occipitomental view showing the shadows of frontal, maxillary, ethmoidal air sinus, orbital cavity, mandible, maxilla, frontal bone, etc. This is frontal, maxillary, ethmoidal, sphenoidal air sinus, orbital cavity, nasal cavity, maxilla, mandible, zygomatic arch, sagittal suture, etc. This X-ray film is done in water's view. Nose and chin is lies opposite to the film. There are Caldwell view, nose, forehead fronte থাকবে to see the frontal and ethmoid sinus. Vessel view to see clearly sphenoidal air sinus. And water's view is done to see frontal and maxillary sinus clearly. Sinus is usually radiolucent, but when infection present, this condition is called sinusitis, and then sinus become hazy, and in X-ray we can see radio opaque shadow. So normal sinus is radiolucent. All sinus develop in intrauterine life except frontal air sinus, which develop 2 to 3 years after birth. Now, what is sinus? Sinus is a air containing space. Lining epithelium হচ্ছে pseudostratified ciliated columnar epithelium. Frontal air sinus, maxillary air sinus, ethmoidal air sinus, and sphenoidal air sinus. Sphenoidal air sinus is seen when mouth is open. What are the function of sinus? They lighten the skull bone. They aid resonance of voice. They aid humidity and temperature to the inspired air. Act as air containing chamber. Maxillary air sinus is the largest sinus among all sinus, and it infection is more common in maxillary sinus because the natural drainage system is poor, because opening is much higher than that of the floor, and it also acts as a reserved space for frontal and anterior and middle group of ethmoidal sinus. So maxillary air sinus is common. Sinusitis হলে ইজিলি হেডেক, নোজ ব্লক এরকম ফিচার পাওয়া যায়। লাইনিং epithelium হচ্ছে pseudostratified ciliated columnar